Good evening, and thank you for my presentation tonight on information on the Health Care Reform Act, the Affordable Care Act, Obamacare, whatever you want to call it. We'll go into some more of those details. My name is Michelle McLaren. I work for ACA Family. I am the regional manager for Texas for that company, and one of their, I believe I am currently 6th in the country on their sales list, and that all, I think, happened because I decided when I started all this, I needed to actually read the act instead of listen to what people told me I should think, and I did so. In reading that act, I got down to the point where I said, this should be translated into English, because I promise you it wasn't. However, if you're having difficulty sleeping, I highly recommend you read the Affordable Care Act. It'll knock you right out. So, I'm talking about increasing your odds in the healthcare gamble. All insurance is a gamble. You pay the premiums because if something bad happens, you want to have coverage, but you're hoping that nothing bad ever happens. So what you have to work out is how to get the best odds in that gamble, how to get the best value for your money, how to make sure that while you probably can't beat the system, how to get it to work to your advantage as much as possible. Then they introduced the Affordable Care Act and everybody got more confused than they were before. Let's see if we can work some of that out. Really? Thank you. All right, I want to start at the beginning. I want to start with some definitions. A lot of people sit down with health insurance and they don't even understand the basic principles of what they're working on. I ask someone, what's your deductible? I don't know. Well, do you know your max out of pocket? I don't know. I just know I pay $25 when I go to the doctor. But then I had to pay, then they sent me another bill on top of that, and I don't understand why. So I like to make sure people can understand that. We start with A because that's the beginning. Affordable Care Act, Obamacare, the Marketplace, the PPACA, which is Patient Protection and Affordable Care Act, it's all the same thing. This sounds like it's an easy thing, but they've done polls, and in one of the polls they discovered that 25% of the people polled said that they approved of Obamacare. That's all. 50% of the people polled said they approved of the Affordable Care Act. Problem number one.
So 75% of people like them both.
Sure. The first part is your deductible. In an insurance policy, the deductible is the amount that you have to pay up front before your insurance is going to start paying. The higher your deductible, the lower the premium. One of the things that the Affordable Care Act has done is limit the deductibles. People think that they're higher maybe because they weren't exposed to some of the deductibles that were available before, but they are actually now more limited than they have been in the past. Your copay, whoa, wrong button. Your copay is that I pay $25 when I go to the doctor. I pay $10 when I pick up my prescription. That is a set amount that you pay for a service or product on your coverage. Not all insurance has copays. You can, in fact, save money on your insurance by not having a copay. And if you're someone who doesn't go to the doctor very often or doesn't take a lot of prescriptions, that might be a great way for you to save money, is to not have those copays. One thing you have to be careful of is there is a difference between no copay and a $0 copay. $0 copay you're going to find mostly on a big group insurance policy. That means when you go to the doctor, your percentage of the copay is nothing. You pay $0 for your copay. No copay means you're going to pay the bill. That bill may be reduced by the insurance, but by the insurance network, but you're going to pay the bill. So that's no copay versus a $0
That's
copay.
really screwy.
That's insurance.
Gives them the premium.
Co-insurance is the amount that you pay after the deductible. It usually is the average is a 20%. After you pay your deductible, you pay 20% of your bills up to a max out of pocket. I've seen 25%, 30%, 50% is the highest co-insurance I've seen. 0 is the lowest, where you have 100%. If you have a really big deductible, you may have a 0 co-insurance after you meet that deductible. Again, that is to your advantage and brings down premiums because the more risk you take up front, the happier your insurance company is going to be. So a higher percentage, 50% on your tier, is going to lower your premiums. That's another thing you can do when you're trying to calculate that risk to lower premiums. And the total risk is how much you pay total when the big bad thing happens. I said when, I didn't say if. I know we don't want the big bad thing to happen, but sometimes they do. So what you want to be prepared for when you're calculating your risk, your gamble, is the big bad thing. If I'm paying this much per month and have this deductible, and the big bad thing happens, what's my total risk going to be? That total risk is something else that there are now caps on within the Affordable Care Act. I will admit that the caps are on the co-insurance max out of pocket and deductible, not on your premiums, of course, although there are rules about how high a premium can be compared to your income. So before 2013, and policies still exist that were initiated before 2013, and they can still be grandfathered for the upcoming year, that total risk was usually your deductible plus your co-insurance max out of pocket. I've seen both of those numbers go above $20,000. I have a client with a $20,000 deductible. This was against my recommendation, but that's what they wanted. Then they had 20% co-insurance on top of that. And there are some policies that have no end to that co-insurance. You just keep paying 20% of your bills. That's changed in the Affordable Care Act as well. After 2014, within the Affordable Care Act, the deductible and max out of pocket are combined to a set total maximum. So if I tell you your max out of pocket, that's going to include your deductible, and even better, going to include your co-payments at the doctor, co-payments at the pharmacy. All of those add together to make your max out of pocket. Any questions on these fabulous definitions? Okay. More useful definitions. This is the wonderful world of initials, because we live in a society where TLAs are highly important. TLA is a three-letter abbreviation. Okay, not as funny. A lot of people have heard of an FSA, which is a flex spending account. FSAs are something you can use. You can put money into those pre-tax, or it can be taken off your taxes at the end of the year if you're a self-employed type of person, if you put it in post-tax. And that money can be used for child care expenses and medical expenses. That has now been capped. It used to have no cap on it. You could put in as much as you want, your employer could put in as much as they wanted, and you could use that, but you had to use it by the end of the year. So there used to be, there would be all kinds of advertisements. Get your LASIK now, get your special dental cleaning now, make sure that you go get your glasses now in November and December to use up your FSA money. It was gone at the end of the year. If you didn't use it, you lost it. They have now capped that within the confines of the Affordable Care Act at $2,500 per year. Why did they do that? Because they don't like them. The FSA was a tax benefit, but it wasn't related to any insurance program, but it still helped with your medical costs. Because they want to encourage people to get insurance, they put the cap on the FSA, and now you can't use that as well. More people use that for child care expenses, though, than medical expenses. HDHP is a high deductible health plan. Now, I know some people who think $1,000 is a high deductible health plan. For an individual, $1,500 minimum is a high deductible health plan in the books. For a family, $3,000. Average $2,500 to $5,000. Within a high deductible health plan, and yes, you can have a high deductible in a plan that is not a high deductible health plan. Isn't that exciting? In a high deductible health plan, you have no copays. You have no first dollar coverage. The only exception is your preventative exam can be covered. But that means when you go to the doctor, you're going to pay your doctor bill. If you pick up a prescription, you're going to pay for the prescription up until you've met your deductible. No first dollar coverage. That is the requirement that they made to give these high deductible health plans, I'm going to skip a couple, attachment to an HSA health savings account. A health savings account is an account that you can get. You must have a high deductible health plan to get one. Again, the money you put in is pre-tax or tax-free, and this money can roll over from year to year. A family can put up to $64.50 for 2014. It goes up about $50 a year. And if you don't touch it, if you have a healthy year, You can roll it over to the next year, and this is true up to 65. So some people use that for another place to put money pre-tax to save the taxes on their money. That money can be used for pretty much anything dealing with your body, meaning medical expenses, dental expenses, optical expenses, things like crutches, like braces, like hearing aids,
Massages.
not over-the-counter medications, massages if they are prescribed. One way to make sure that you get in with that is if your massage therapist is through a chiropractor and bills through the chiropractor, then it's chiropractic care and then it's covered. But chiropractic care, those procedures don't have to be covered by your high deductible health plan. You can still use your HSA money, but you do have to have the high deductible health plan to get that HSA account. You do not have to have a HSA account when you have a high deductible health plan. Some people just do it because they don't go to the doctor, they don't care about the copay, and it's a cheaper health account. HMO is a health maintenance organization. More group policies are HMOs than individuals, but there are some individual policies available. And those are a very limited doctor account. That's where you have a limited network of doctors that you can go to, and you must have a referral to go to another doctor, even if the doctor is still in network. So you go to your primary care, you can have a bone pointing out of your leg, and you know you need to go to a surgeon, but your primary care has to authorize the surgeon. Okay, if the bone is poking out of your leg, go to the ER. But you can know what's wrong. Your PCP, your primary care physician, can know what's wrong, but you still have to go through them for any appointment. That can make the money you save on a HMO plan disappear a little bit when you're paying more co-pays or more doctor visit money. So
You're going to have to pay 2 doctor visits to do it.
That's right. HRA is a health reimbursement account. This is an HSA is owned by you, the individual, or the employee, if it's at a company. An HRA is owned by an employer. It is one of the few ways for an employer to help pay for an individual health account or individual health expenses without purchasing group coverage. HRAs have increased in restrictions since the Affordable Care Act. They have to be very careful who has what and where. If they are used to help pay for premiums, the premiums must be for an ACA compliant, Affordable Care Act compliant plan. The network is a group, gives you a discount on services. Be in network. I'll talk more about that. Just get used to the fact that network is where you should be on all medical things. And PPO, which is the primary source or primary network function in an individual policy, preferred provider organization, still a network, but you don't usually need a referral to go to a surgeon or to go to a specialist, an ENT, an orthopedic, that sort of thing. You can just choose them as long as they're in network, so you don't have to go through your primary care physician. Any questions on those? Okay. Why do I need to be in network? I just said that, didn't I? I said be in network. Why be in network? Okay. Your insurance company has negotiated with a group of doctors and hospitals that they are in network, and they will take for your procedure what the insurance company has agreed to pay. If you are out of network, those doctors have not agreed to take that. And that's all the insurance company has agreed to pay, so there's going to be extra money you have to pay. In network, the Affordable Care Act has set the max out-of-pocket at $63.50 for an individual and $12.7 for a family. It's going to go up a little bit next year. I believe it's $6,500 and $13,000 for an individual and family. In network. There are no caps on the out-of-network. And the one I discovered recently that's kind of scary is you can have a max out-of-pocket on your out-of-network. You can have a, let's say, $30,000 max out-of-pocket for your out-of-network, and you've paid all that because you went to an out-of-network clinic for a surgery. And then you have another bill that's out-of-network. Your insurance company still only has to pay what they consider a reasonable and customary rate, and if the doctor doesn't choose to take that, you still owe the difference. Stay in network. The place where this gets difficult for the consumer, for us, is your doctor may send your labs out somewhere. You get some blood work done, they send the labs out, and they don't tell you where they're sending them. You need to ask. You need to say, okay, this is my network, please make sure that you're sending this to an in-network lab. Because they may send them somewhere else that's not in-network, and just because your doctor is in-network does not mean their labs are not. Not mean their labs are also in-network. The hospital that they work at may not be in-network. So these are things that can help you save money. The ACA, the Affordable Care Act, has limited the in-network stuff, but they could only go that far. I have actually called the Texas Department of Insurance on this to say, hey, this doesn't seem fair to me. If you've met your max out-of-pocket, out-of-network, doesn't mean that mean you're done? And they said there's nothing they can do about it. The insurance company will only pay what they have to pay. If you do find yourself in this situation where your doctor is charging more than the insurance company will pay, don't pay the bill until you've talked to your doctor and said, hey, this is all my insurance company will pay. Can we negotiate here? Lots of them will, but they're not going to tell you that in advance, because otherwise you're paying money. And you have a lot more power in your appeal, even if you have to go through the Texas Department of Insurance, if you haven't paid the bill yet. It's a lot easier to keep you from having to pay a bill than to try to get any money back. So stay in network. The networks have changed. They have gotten smaller on most of these programs, but not too bad. Now, if you're in an HMO, if you go outside of network, except for an emergency, you have no coverage. So that's something to consider as well. The network rates do great things. When my son was in a motorcycle accident this summer, $12,000 in bills, ambulance, CT scans, a doctor having to come in and yell at him, $12,000. After my network reduction, $4,000. That's why we have insurance. At the moment, maybe that's not the greatest way for the system to work. That's the way the system works. You need to have a network. All right, so we're here to talk about the Patient Protection and Affordable Care Act, PPACA. These days it's mostly just ACA, ACA, ACA. I've heard all of those things. Obamacare, the exchange, the marketplace, all the same thing. Now, this is not the government providing insurance. The government does not provide insurance. The government provides a way to help people pay for the insurance and has created rules and regulations that the insurance companies have to follow. This is not something that is melding well into the community. I have had doctors tell myself, my clients, oh, we don't take Obamacare insurance. Yes, you do. But what they're trying to say is they don't take this network because they think it came from healthcare.gov. It's going to be the same network from a company on or off healthcare.gov. It's just who's paying for it. I did have reports of a doctor's office who asked, did you go to healthcare.gov and get help paying for this plan? And if you said yes, then they would refuse to see you. That's not legal. So if you hear about that, it should be reported, because that's not fair. Does your doctor have to take the insurance? No. Does your doctor have to take any insurance? No. That's one of the problems we'll have to deal with. But right now, this is what we have, and it is a law. We kind of made, in my home office, they came up with this, which I liked, which is partners producing affordable, clear alternatives. That's my job, to help you understand the clear alternatives to what's out there, because it's not all one choice. These are some important dates to remember. Coming up on a Saturday, November 15th is when the Affordable Care Act open enrollment begins. You don't have to enroll on November 15th. Don't enroll on November 15th. There's going to be a bunch of crazy people going on the computer, and I've got other plans for that day. We'll enroll on the 17th, 18th, 19th. We'll be fine. However, if you want your policy to start January 1st, you do have to be in the system by December 15th. That's our next important date. And February 15th is the last day to enroll in a plan that is Affordable Care Act. If you miss these dates, November to February 15th, then you have to have a special event. Death, divorce, loss of a job, new baby, child turning 26, hardship.
When you turn 65.
When you turn 65. All of those things, well, when you turn 65, that's not a special enrollment period to get into the Affordable Care Act insurance or get into an insurance plan. That's when you get out and go to Medicare. However, If your spouse turns 65, that is a change to your coverage.
Well, a change of job would be one, right?
Yes.
Because what is, I know somebody that's gonna be retiring, he's got insurance at work, and at 65, well, 65, the insurance is gonna change.
Yeah, it's going to go to Medicare at that point. But
Yeah, but he'll
Yeah.
get something on the side.
changing a job or your spouse doing so qualifies. But the best thing is to try to get in within these dates. When they created this program, this Affordable Care Act, what were they thinking? They caused a bunch of fuss. Everybody got cranky. But it still got made a law because there's purposes here. This is a bunch of gobbledygook. I copied it out of the Affordable Care Act. You can read it if you really want to. But basically what it says is personal responsibility. They're asking everyone to have an insurance plan so that if the bad thing happens, you're covered. Because at the moment, if the bad thing happens and you go to the hospital, they have to stabilize you anyway. Somebody has to pay for it. So take the responsibility, get the insurance, get some coverage. This is how they did it in detail, is a part where I might disagree with the act, but that's okay, they didn't ask me. When I run the world, I'll fix it. So responsibility is really what it all boils down to. And this is a statistic out of the bill, but it is absolutely true, and I've heard it before. 62% of personal bankruptcies involved a medical expense. I'll tell you one on top of that. 75% of those had insurance. They just had insufficient insurance or lousy insurance or didn't understand what they had. That's part of what the Affordable Care Act is trying to fix. You shouldn't be paying for insurance that can't help you when the bad thing happens. Rumor. The law says I have to have health insurance, and I don't like that. Fine. Don't get it. The law doesn't say you have to have health insurance. I don't believe in health insurance. Okay. The law says if you don't have it, you're going to pay a tax, a penalty. That money is going to help pay for things when you get hit by a bus and don't have insurance. And that bus may say Greyhound, and that bus may say cancer. Because these buses, they're all over the place. So you don't have to have insurance. But if you don't, you're going to pay what they call the personal responsibility payment to help pay for the medical expenses that are caused by accidents happening. Because the law doesn't say you have to have insurance, that's where there's options out there. And that's where you talk to an advisor, an agent, who can help you understand catastrophic policies or critical illness standalone policies or accident policies, something you can afford so you got better than nothing. Because the Major Medical Insurance Affordable Care Act isn't fitting everybody's needs. But if you understand what all the different financials are up front, you can protect yourself and your family and still eat. You know, have a house, those crazy little things. I love this thing, really. When they initiated the Affordable Care Act, what is a Obamacare policy, or what is called a qualified health plan, has to meet some mandated services. It has the coverage of the essential services. It has no lifetime limits. Here's one people didn't think about. They used to, you could have a policy that say, okay, we're going to pay, but if you pass $100,000, you're out of luck. Then they raised that to, that they would pay your medical expenses, but there was a limit that they would pay out. They only took so much of a risk. Just like your auto insurance, maybe a 100-300 policy, meaning they'll only pay $100,000 up to $300,000 in expenses. Medical insurance could do that too. Not anymore.
Yeah, theirs wasn't a yearly limit, it was a lifetime limit.
Yeah, and medical had both annual and lifetime limits.
Yes.
They have set the out-of-pocket cost to a limit that is much more reasonable than it used to be. They've guaranteed renewability of the coverage. You cannot be denied the ability to renew your policy. You can get your rates increased, although there is better oversight on how much they're increasing those rates. But they can't cancel you. Big thing is no pre-existing condition limitations. We know somebody, we all know somebody who has diabetes, who has a heart condition, who is overweight, a brain tumor, even a benign brain tumor would get denied. Asthma and allergies would cause rate-ups. My own family, we had rate-ups and riders for asthma and allergies. They said, nope, that's a pre-existing condition, we're not going to cover it. even though it was well controlled. So they can't do any of that anymore. The only thing you can get your rate increased on is for tobacco use. They've even decreased the rules on that so that the occasional cigar user is not getting dinged the way an everyday cigarette smoker is. It is now, used to be, have you used tobacco within the past 12 months, you're a tobacco user. Now it is, have you used tobacco in the past 6 months, 4 or more times per week for non-religious uses? They're very easy.
So I'm guessing there's people out there starting churches where they
All
smoke
over the
every.
place. But it's still not more than 4 times a week.
The sweat hut has.
And
And this is the part of the bill they did right.
Children are now able to remain on their parents' policies through age 26. It's nice. It means your kids in the middle of college, they don't suddenly fall off your insurance. Or maybe it means you can help them out while they're starting off in the world of work. Because it is usually cheaper to have them on your policy as a child than for them to get their own policy. Those essential services are things that the qualified health plans now have to cover. Some of the things that weren't covered before, individual policies pretty much never covered maternity. Now they have to. They didn't necessarily cover pharmacy. They have to. They very rarely covered mental health. They now have to. They also have to cover pediatric, optical, and dental care. Make sure that your plan covers it. There's a little wobbly thing there when you're on the marketplace. You have options on the marketplace for your dental, so they don't always build it in. You got to be careful of that. It was something they didn't tell us about very well when we were signing people up last year. Now, does this mean they have to pay for all your drugs? No. They have to pay for a certain percentage of drugs in each category, so there are still medications that are not covered. They can have tiers of coverage depending on how specialized the medication is and how much of that they will cover. But they do have to cover some type of medication in each category. Yes, they can require you to take generic medications. And if those don't work for you, you have to go through a step program to prove they don't work for you with your doctor. They have to cover labs and tests, but you may have to get pre-authorization for those labs and tests, and you need to be prepared to do so. An MRI almost always takes a pre-authorization or a peer-to-peer, meaning your doctor calls the insurance company, review before they're going to authorize it at this point. It's just the way they're doing things to make sure that there's not excessive tests being done. Good that we don't want excessive tests being done. Bad if you're the person who is in a bad way right now and wants to make sure that you're in pain, you want your MRI so they can figure out your knee surgery. Hey, that's a bad thing. But if you're aware of the system and the way it works, you can expedite things. Using an agent can also help. In the Medicare and Medicaid expansion of the Affordable Care Act, they did expand some of the programs. Medicaid can now cover up to people in 138% of the poverty level. It was 0 to 100%. Now it's up to 138% if the state chose to expand the coverage. They also increased the amount of long-term care coverage. They're working on closing the donut hole that exists within prescription drug coverage. And those are all just to help cover more people and cover them better. But it was optional in the states to choose that expansion. In Medicaid, Medicare is national, but Medicaid was optional and Texas is not one that opted. We'll see if it changes, but I wouldn't hold your breath. So when you're going on the insurance exchanges, that's the marketplace. Again, this is not the government providing insurance. This is the government providing a place to shop for it and a way to get help paying for it. So you only want to touch the exchange, which is for Texas, healthcare.gov, if you are going to qualify for help paying. That means you earn between 100 and 400% of the poverty level. Then you're going to get a tax credit, which helps you pay for it. And that tax credit is given to you every month in advance. So you don't have to wait till the end of the year. You can choose to do so.
Straight to the insurance company.
Yeah, it goes straight to. You may choose to wait till the end of the year and take it as part of your taxes. I haven't had anybody do that yet, but you're allowed to make that choice. So, for an individual, you need to be making more than $11,670 in 2014 numbers, and less than it was 45,000 some odd in 42,000 some odd in 2014 45 in 2015.
And this
Is
is
that AGI
Just
or
a-
straight?
adjusted gross or
Modified
taxable?
adjusted gross. What does that mean? I'm waiting for my friendly neighborhood tax attorney to find out, because we don't exactly know.
I don't think they put the forms out yet.
They have not. But if you want to estimate, okay, I make $35,000 a year. Okay, that means that you will qualify for a tax credit, or if you choose not to get it, that 1% penalty, just choose 1%. It'll probably be less than that, but just figure your numbers with 1%. So, some states set up their own program. Some shared with the government, some chose the federal program. Here in Texas, we are healthcare.gov, the federal program. And they also required that all health care plans that are qualified health plans fall into one of 4 categories. They call these the metal plans: bronze, silver, gold, platinum. 60% aggregate coverage, 70, 80, 90%. How much is the insurance company paying? Bronze plans are the cheapest, sort of. Bronze plans are going to have the lowest premiums. If you are between 100 and 250 of that poverty level, you're going to qualify for cost sharing on silver plans. That means you may pay more per month for a silver plan, but the cost sharing reduces your deductible and your max out of pocket, so that your total risk can be significantly lower than on a bronze plan. Not just a little lower, like it is on a regular silver, but significantly lower.
So cost sharing means the premium?
Right. Well, no, the premium is where your tax subsidy goes. Cost sharing is the deductible and the max out of pocket.
Oh, so it's in
So, for
addition to
example,
subsidies.
If you only make $20,000 a year, you're in that under $250,000, 250% of the poverty level range. So first you're going to get a tax credit to help you pay for your premiums. Then they're going to reduce your deductible. So the plan that I sell to someone who makes over that amount has a $2,500 deductible. For you, it may have a $500. So it's something you had to explore and be aware of. Now, I will absolutely tell you, this was not explained well. I went through months of going, okay, online, it's showing me that this plan has a $500 deductible, and I know that's wrong. How can it say that? There's something wrong with the system. I went to the congressman's office, and I said, I don't understand. Tell me why they're doing this. I called healthcare.gov. I said, tell me why they're doing this. I don't understand. They didn't know either. By the way, at healthcare.gov, you got about a 1 in 4 of catching a brain, and that is someone who has taken a solid statistical analysis. I wish I could get a direct line to the ones that I found with brain, boy, let me tell you. But I finally got it explained, got it figured out by seeing that some companies were actually listing, they know right up front, if you're at this percentage of... What is the tax penalty? What are we talking about? Well, the tax penalty, which the government would prefer to call the shared responsibility payment, is an amount of money that you're going to pay if you choose not to have a qualified health plan. For 2014, it was $95 per adult, half of that for a child, or 1% of the family's modified adjusted gross income. So again, $35,000 a year, $350 a year penalty. Lots of people said, okay, fine, that's a lot less than insurance, I'm just going to pay that. Okay, that's your choice. When I talk to people, I do say, okay, you've made that choice, now you have no insurance. Maybe we can look at an option, because that's where those catastrophic plans come in. There are catastrophic plans on the marketplace, but an interesting fact is you cannot get those tax credits on a catastrophic plan, not even the ones that are available in the marketplace. Those catastrophic plans on the marketplace are only available if you are under 30 or have a level of income they consider to be a hardship. So you got to watch out for those things. So that's what's going to happen when you file your 2014 taxes. It's going to be in there somewhere. 2015, we're going up to $325 per adult, or 2%. And then it goes up to 2.5%. It's supposed to cap out at the amount of an average bronze plan for your age group and area. That's going to be fun for the tax people to figure out. I'm so glad I'm not a tax people.
That's when we quit doing taxes.
That's right.
That's when I
There are
retired.
exemptions available. When I'm helping someone figure out their whole risk, I talk to them about, okay, you make $35,000 a year, that's $350 or less. I'd be willing to stake money it's going to be less. How do I know that? Well, it's 1% of your modified adjusted gross. Modified usually brings things
I
down.
think it's gonna be higher, they're gonna add in tax-exempt income.
But they also, you can go 3 months of the year without having insurance and still be okay. So that means that they're probably only going to charge you 9/12 of that. If you have a hardship, you can file for a hardship exemption. If there was a job loss during the year, if there was a new baby during the year, certain Indian tribes, all kinds of things. If you can show that the income or that the premium would have been more than 8% of your income, that's a hardship.
There's another form you can fill out, if you've got a disconnect notice from your utility, you can get out of it. So call your utility up, tell them you're not paying them this month, and
So there's lots of ways, there's lots of exemptions that are going to be available. And this year, it's going to be a royal pain. I feel sorry for every tax preparer I know,
thank you.
and including, mine. And they're going to have lots of fun with this, but there's still people who are saying, okay, 2%. I make $35,000 a year, that's $700 for the year. Okay. That's less than $100 a month. Can I get an insurance plan for that? Maybe. Probably not. Depends on your tax credit. Let's look into it. That's where you have to consider your whole picture, where you realize that the law doesn't say you have to have insurance, or doesn't say you have to have major medical insurance. Maybe you pay that penalty and get a catastrophic policy and you're good. And that's very acceptable. I will say the people that make between 400 and about 600% of the poverty level are the ones who are having the hardest time with all of this. They're not really making that much more money. $45,000 for an individual, especially if you have a house, maybe a car payment. The idea of paying $300 a month or $400 a month for your major medical is kind of high. And so maybe that catastrophic plan is the way to go and pay your tax credit. All that matters is that you know what you're doing. That's the important part, is know what you're doing here. So that's how the tax penalty is going to work, provided it works. We'll find out when we file taxes. Why did these costs go up? Why was the plan that I could sign up for in 2013 $150 and in 2014 $250? That's just because they wanted to make things more expensive. They're just trying to rip us all off. No, they're not. They have increased the value of the plans. This is part of what I've just mentioned before. Part of the things they did to make sure that you're not having insurance where you're paying for insurance and still end up bankrupt. Because they've increased the value, they've put caps on things to make sure that people are safer. One of the big ones is the in-network max out-of-pocket. That now includes your deductible, includes your co-pays, and $6,350 sounds like a lot of money. Oh my God, a $6,350 medical bill is high. Not if you had a heart attack.
Or knee surgery.
Knee surgery can be $30,000. Knee surgery within the DFW area can vary tens of thousands of dollars, which is a different problem I can't solve. But you find your in-network place, that's the max you're going to pay. Your deductible, your co-pays, and your co-insurance cannot add up to more than $6,350 in 2014, $6,500 2015 for an individual. For a whole family, well, it used to be you could have a $10,000 deductible per person. You could have a 5-person family, that's $50,000. Nope, 12,700. So double the individual deductible is the max for a family.
Does this include the high deductible health plans? Are they one of those? So if you get a $5,000 deductible anyway, you're only going to have $1,350
Right.
more.
That's something else that you look at when you look at the different costs. Well, wait a minute. If my max out of pocket is $6,350, whether I have a $5,000 deductible or a $1,200 deductible, that $1,200 deductible plan is a lot more expensive, and my max out of pocket is the same. I'm just going to have the $5,000 deductible. Mine as well. I never go to the doctor anyway. That's the thing I hear most often. I never go to the doctor. I don't need this stuff. I really hope and pray that that's always true. And did I mention a motorcycle accident earlier this summer? Yeah. By the way,
We've had a couple of them this year, right?
having your teenager start his senior year summer vacation with a motorcycle accident, don't do that. I don't recommend it. It's a bad plan.
A lot of the employer plans are coming in with those numbers.
Yes, they
You
are.
figure out where the 6,350 came from.
That's
that I was
exactly
seeing
where.
on
And there are
people's
programs out there,
benefits.
you'll find supplemental plans that are designed to fit exactly that
Right.
gap
Yeah.
for accidents and critical illnesses. And those are great plans. I recommend them highly.
And that's something you buy on the side that would cover that deductible.
And gee, I know someone who can get it from. But the fact that the copays and deductible are included in that is a lot bigger than people realize.
It's huge.
It is huge, and that is a
Huge.
lot. 12,000. Oh my gosh, my family could be out $12,700, $13,000. You are actually not that likely to lose your house over a $13,000 medical bill. It can be usually negotiated with the hospital, paid out over time. People understand that, but let me tell you, a $50,000 medical bill, a lot harder to deal with. So they put caps on that, but you got to be in network. Don't forget to check and make sure you're in network. They have removed pre-existing condition limitations. This has allowed thousands of people to get insurance that couldn't get insurance no matter what they paid. I know a guy who is a perfectly healthy diabetic. Since I've known him, he's lost about 200 pounds. He's given up smoking. He looks great. He's done everything he is supposed to do to help himself be healthy, and he couldn't get insurance because he's diabetic. Now he can. In fact, he did. We took care of that. You can have had cancer. Some companies would say if you had cancer ever, they wouldn't cover you. Most of them had about a 5-year look back, maybe 10, depending on the severity of the cancer. Nope, sorry, we're not going to cover you. Well, at this point, you can be in the middle of cancer treatments, and they will cover you. Just got to get in that open enrollment time. A heart attack, a stroke. All these things, a variety of diseases, would either cause rate-ups or riders in the past, or declines. Those are gone. That is huge and has really helped thousands and thousands of people. They've added coverages. When I went through the essential services, adding maternity care. Yes, I know, some people don't care. It doesn't help the average 60-year-old male. Okay, but you know what? I'm paying to make sure that I can have PSA tests and colonoscopies, which doesn't help the average 44-year-old female. It's okay. It's like we all pay school tax. It all balances out. But the pharmacy coverage is important. The mental health coverage is important. Obviously, we all need mental health coverage. And there are no annual or lifetime limits. I know a person whose son was in the hospital, and he was in and out of a coma for 6 months. It is, by the way, more expensive to be in and out of the coma than just in a coma. Because every time you revive, that's a lot of stuff that they have to pay money for, and then it backs down again. And at $1 million, their insurance company stopped paying. Well, they ended up filing bankruptcy because it went about $500,000 over that. They didn't have it. That's gone. No annual or lifetime limits. So there are really good reasons the costs have gone up. And the hope is that over time, as more people are in the system, more people are getting insurance, more people are getting their preventative exams, which are covered 100% under all qualified health plans. As all of this happens, the medical costs will go down. They are actually already starting to go down. And then the insurance costs can go down. It's just like when there's been a hurricane, all our home insurance prices go up. But it can settle down when there's been years with no bad weather, although we don't appear to have that in Texas anymore. But as people take the proper precautions, get healthier, then the medical costs can go down, and so can those insurance costs over time. A lot of things that are in the Affordable Care Act that people don't hear about are wellness programs. A company can say, hey, we're going to put $1,500 in an HSA account for you or towards your deductible and coinsurance if you get your preventative exam and bring us your results, or if you participate in this stop smoking program, or if you participate, maybe they have a fitness program on site. All those things, those are tax deductible programs for them. They get tax credits not only for giving you the money, but for having the program. There's programs out there where doctors and nurses can go to rural or impoverished communities and get their student loans paid off for agreeing to work there. So there are other programs out there trying to make everything healthier and smooth out these medical costs that can be extreme, because we know they can be extreme. You know, $1,700 for an ER doctor to come in and say, hey, your shoulder's broken. Thanks. I kind of figured that by the pointy bit. That has to get worked out over time, and part of the Affordable Care Act is the committees, is the oversight, is the work to do that. Unfortunately, the part about the individual mandate got screamed and the rest of it got whispered. So that's what we're working on. That's why your costs have gone up. It's because they're giving you more coverage. Now, why did you have to lose plans? If you like your health plan, you keep it, and then you lost it. Because those health plans that you lost were not giving you this kind of coverage, and the companies that were providing them said, not worth it. We're out of here. I don't think that the creators of the Affordable Care Act thought that was going to happen. Who's going to give away business? Who's going to drop business that they have? They're going to want to improve their insurance so it meets these guidelines. No, not really. Those were the insurance companies providing the insurance that 75% people had of the bankruptcies, where you had insurance but you still lost everything. They were crappy insurance. But all the people saw was their plan was canceled. Their affordable, not really helpful, but affordable plan was canceled. And now they've got to take another one. Yes, that has happened. But it was because it wasn't meeting these values. It wasn't giving you the things you need from your insurance.
Well, there's, you
Yes.
know, you're going to get to the part where the insurance company has to spend so much money on care, or
I
they...
don't actually have that in here. That's called the medical loss ratio. So of the premiums that a company takes in, 80% now has to be spent on client care. And if they don't spend that, they have to give some back. I got a check from Cigna for 2012. Wasn't a very big one, but I got one.
Also, that will eventually reduce costs.
Yes.
Well, and it helps them, you know, we're either going to have to get this back or we pay for the service.
That's right.
It's going to be easier to get service approved.
Now, I'll tell you the absolute tragic part of that. That means that a company like Cigna or Blue Cross or whoever has 20% of what they bring in for all of their overhead. So your average, everyday, absolutely fabulous insurance advisor is getting bupkis for the average major medical plan.
Yeah.
But, so I try to sell a whole lot to make my bupkis get a little bit bigger. It's okay. That's why we have other things. That's right. And if that's what they got to do, that's what they got to do. Because we do want to make sure that it's better for the public. But yeah, that's called the medical loss ratio. Okay, for businesses, a lot of businesses are freaking out. Because now, oh my gosh, I have to provide insurance. Well, first of all, if you have 50 or fewer full-time employees, you don't. You're fine. You're all good. You don't have to. And it's full-time or full-time equivalent. So if you have 2 people, each working 20 hours a week, that equals 1 full-time equivalent employees. And it goes up the scale. If you have more than 50 full-time equivalent employees, you only have to offer insurance to the full-time employees. What? Okay. And for 2014 and 2015, if you have less than 100 full-time equivalent employees and you didn't offer insurance and then drop it, they're actually giving you another year. Now there was a loophole called minimum essential coverage. A company can provide minimum essential coverage to their employees. Minimum essential coverage pretty much had to cover preventative exams. And if an employer was providing that, they were off the hook, and the employee was off the hook. They both had what they were required to have. However, I was sent an article today that said that they are closing that loophole at least somewhat. Your minimum essential coverage plan now must include in hospital benefits. Because I've seen them that didn't. They didn't cover anything but the preventative exam. That was it. They still cost $50 a month. It was ridiculous.
It's
And that was
like an
the employee's portion.
It'd be cheaper to just pay for the exam.
Absolutely.
Be self-insured.
But then you didn't have the penalty.
Right.
One of the things I really like to do is get people to sit down and find out how much that penalty, at least estimate, really is. And they go, that's it? Yeah, it's okay. We work on it. It's all good. A larger business is going to have to provide coverage. Most of them do. The companies that are having problems are those that were actually between 50 and about 500 people. They may not have been providing coverage, especially if a lot of those employees were part-time or seasonal. And there are exemptions for seasonal employees. If the employee is working for you less than 90 days, they're considered seasonal, and you don't have to count those in your numbers. But the companies are getting tax credits. Smaller companies are getting tax credits for providing coverage or helping provide coverage. And the larger companies are not only getting tax credits, but you're giving a benefit. This is not actually the part of the Affordable Care Act I think they did right either. But again, I don't run the world yet. When I get there, we'll fix it. So a business does need to figure out what they want to provide. But again, it is still not a law that you have to provide coverage. But if you don't, you're going to pay a penalty. So a lot of companies are weighing that pay or play decision because it is $2,000 per full-time employee if you don't pay. By the way, they don't know that you didn't provide coverage unless someone goes on healthcare.gov and applies for a tax subsidy, which is why some of these minimum essential coverage plans are getting away with being crappy. Because I've got insurance, so I'm not going to go on healthcare.gov because then I'd have to click that button that says I do have employer-sponsored coverage, and it wouldn't help me. Yeah, because if you get the tax subsidy, that's how they know your company isn't providing. So the companies have to decide what they want to do. If they drop coverage or choose not to provide it, they may have to pay that penalty per full-time employee. By the way, the first 30 are free. I don't know why they came up with 30. So if you have 60 full-time employees, you're only going to pay that $2,000 on 30 of them. Whatever. But you also have to deal with the fact that your employees say, wait, no benefits? You better give me more money. Or I'm going somewhere else. You also have uncertainty as to whether or not your employees are insured and whether or not they are taking proper health precautions. If you run an auto shop, don't you think maybe your employee should have coverage for dropping something like a car on their foot? It could happen. Or if you run something simpler, you may go through a lot of time and effort to train people, but when they're out with the flu, because they didn't want to take the money to get their flu shot, then you've got to train another person or deal with them being absent. So these are things that an employer has to consider. If they continue the coverage, well, then they don't have to pay the penalties. They do have to worry about the cost of the coverage, but employees will take less money, and they will take less salary by more than you've cut than more than that cost of coverage. And I've seen it happen over and over. Okay, my coverage is going to cost $500. I'll take $700 less a month if I have coverage. They're not thinking of it that way, but it's the way it happens. Which is why when you're getting offered a job without benefits, you should look into the cost of your own coverage, because that's things to do. And it lets you know that your employees can stay a little healthier. And yeah, you can say, please go get your preventative exam. Maybe give them certain afternoons off or something. It's great. So it's something that people have to decide. Ta-da. So that's what I have on the Affordable Care Act. I really don't want it to be a political discussion or a sales discussion. I can't give you 2015 numbers anyway. They don't exist yet, except for, okay, they do, but they won't tell me.
It's because they wanted the elections to be over with before everybody got sticker shock.
That was the rumor, yes. Actually, the latest thing I've seen, according to Humana, is that on November 7th, the healthcare.gov intends to have their estimators up and online. So we'll see if that's true. I'm kind of hoping. But what questions can I answer?
Age 65 and older is still working, HSA.
Okay, if you have, my understanding is if you have an HSA, once you are 65, you can then, you can use that money for medical expenses tax-free, or you can take it out for non-medical expenses and just pay the taxes.
Can you
There's no
still roll
penalty.
it over to an IRA?
Yes, you can.
And can you still contribute to an HSA if you're over 65? Because I get that question from employees, and I haven't been able to find the.
I don't think you can
If you
because you no
can't,
longer
yeah, if you have
a
to
high
take,
deductible
yeah, if
health
you have
plan.
to take it out.
You don't have to take it out.
No, but
You
you
can
no
take
longer
it.
have a high deductible health plan, which you have to have to be
But
able to
you could.
contribute to your HSA.
You could have a high.
If you
deductible.
still have a
If
high
I'm still
deductible
working.
health plan, then yes,
I'm
you should
still
still be
working.
able to contribute to it.
Yeah, and I looked through,
Why would you have a high deductible health plan once you got on Medicare?
I'm not on Medicare, I'm taking my employer's. That's not me specifically, but my employee health
Group insurance can
plan, my
cover someone
group
over
insurance
65.
is much better than Medicare.
Oh, I thought all employers' health plans automatically canceled at 65.
They do not.
Individual
The
plans.
individual, you cannot get an individual health plan after really 64 and a half. I mean, you can keep it, but you can't get a new one. But group plans can opt to continue people who are over age 65. So if you are still in a high deductible health plan, you should still be able to contribute to your HSA. But if you're not, if you're in Medicare or something, then you're not going to be able to contribute anymore. And before you're 65, you can still take money out of your HSA for non-medical uses, but you're going to pay the taxes and a penalty for doing so.
I couldn't find anything when I went through the material on it. You know,
I have found a couple of banks in the area that will open HSA accounts for you, and they will ask to see your insurance. I haven't noticed them getting real strict about it, but you have to be prepared that if there's an audit, because I have known people who've opened them without having the high deductible health plan, and somebody can audit you and check. DATCU will do them, and Sierra Bank. They will.
North Star does them also.
North Star does?
Yeah, I was
They didn't tell
surprised,
me
I
that.
found it in their mailing.
Okay, that may be new
Which is
because I've
funny,
asked them and they
because
didn't.
big companies like Chase don't.
Actually, Chase does.
But you have to have different
It's
accounts.
expensive.
Yeah.
Chase
Chase
does
is
not, I had a
expensive.
client go check and Chase told him
I
no.
have a client who has one.
Really?
I think it may depend on where you go through, and you may have to go through the online sources. Bank of America advertises them online, but their branch didn't know about them when I contacted them.
That could be, yeah, local
That
branches
might
be
just
that
might
maybe
not
the branch
know.
didn't
'cause
know.
I
I
don't-
have a client who lives in Flower Mound who got hers with Chase. and
I used to have one through
I let her
Fidelity.
know about North Star because it was a better deal at North Star.
Okay, so North Star-
Fidelity and some other financial venues will have them, but I've noticed that they're more likely to charge you. But I know Sierra and DATCU and maybe North Star don't charge.
You charge.
You can invest the money in an HSA account, like in a money market
Mutual
or
funds,
something,
Even,
but you're taking the chance.
and you don't know, and the bank may not offer it.
Right.
They may offer only,
But you have to have a set account. You can't say, hey, this is my HSA money in this checking account, so therefore I save the taxes on it. It doesn't work that way.
No,
Any other questions?
the high deductible plan, what is the highest deductible you can get now?
$63.50 for an individual, $12.7 for a
So
family.
they've gone.
And I haven't seen the plans yet, but I believe it is $6,500 for an individual and $13,000 for a family for 2015. Other questions? Okay, well, thank you all for coming.